I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. It's important to me that the supplements I use are of the highest quality, and that's why for more than 3 years, I've been drinking AG1. It is researched and developed by an in-house team of scientists, doctors, and nutritionists with decades of experience in their respective fields. Quality for AG1 isn't just a buzzword. It's a commitment backed by expert-led scientific research, high-quality ingredients, and rigorous testing. I know I can trust what's in every scoop of AG1 because they obsess over product quality, the standards of manufacturing partners, and sustainable practices. It's easy and fast to use. Drinking AG1 mixed with water in 1 scoop a day covers my nutritional bases. Prebiotics, probiotics, digestive enzymes for gut support, B vitamins and rhodiola for energy support, folate, magnesium, and ashwagandha for stress support, and vitamin C and zinc for my immune health. So if you want to replace your multivitamin and more, start with AG1. Try AG1 and get a free 1-year supply of vitamin D plus K2 and 5 free travel packs with your first subscription at drinkag1.com/Fiona Lovely. That's drinkag1.com/Fiona Lovely. Hello, listeners. This is Dr. Lovely, and I am continuing this cluster of episodes that I'm calling basically taking care of your mentals. And more I'm seeing that we as women have these massive brain changes at menopause, perimenopause. And of course, we know this is happening. We have the research now to look at those neuroendocrine changes. But for a lot of women, what's happening is that we're experiencing these huge mental health shifts at perimenopause and menopause. And the understanding of this is academic at this point. And there are few practitioners and even fewer women really that know to ask the question of their healthcare provider. This is my attempt at making my contribution to righting the wrongs of women's health care at midlife and give as much information as I can so that you can carry it to your healthcare provider, because I believe that the more empowered and informed you are, the better decisions you make for yourself, but the better questions you ask of your doctors. And I think the more of us that are asking these questions, it's just going to be undeniable that family medicine practices and general practices and even the gynecologists have to do much better at taking care of their female patients. And I understand this is a systemic problem. Med school wasn't taught I don't want to say any, but very small amount of menopause medicine was even taught. I think that is changing, but the practitioners who are taking care of us now, us women in perimenopause and early menopause, we're blazing a trail. No surprise, right? Who better to do that than Generation X? So I am going to re-release a mini episode I did a couple years back called Mental Health and Iron and what the connection is. I think this is a really important discussion and something that often gets missed. Lots of us have anemia. Lots of us have iron deficiency anemia. Lots of us have B12 anemia. And it quite often is being overlooked in the medical office. And it is incredibly important when we're talking about a mental health related complaint, or what I see a lot in my office is women who have traumatic brain injury, like a concussion, but they don't get well with their neuro care. And 9 times out of 10, when that happens, if I look at the blood chemistry, I will see that they are iron deficient anemia. They are deficient in iron causing anemia, or IDA, iron deficiency anemia. But not all medical providers know this. And the remedy, of course, is replacing the missing iron from the system. Okay, now there is an entire episode on how to do that. It is episode 86. Please go listen. If you know you are iron deficiency anemic, or you've got one of the other anemias, please go listen to that episode because I cover it all. Be prepared to take notes. There is a lot of information in that episode. And again, this is getting more and more relevant. So women between the ages of 30 and 60 are twice as likely to experience depression and anxiety. Is that simply a matter of hormonal changes? Or are there other reasons for it? Or maybe there's more than one reason, because things are never linear when it comes to the human body, let me tell you. So we want to look at iron. We want to look at B12. We want to look at ferritin. These are the markers in the blood that we want to look at. Because if you are low in any of those things, it means your body cannot keep up with red blood cell production, which means your red blood cells are not robustly available to carry oxygen to the tissues, especially the brain, all tissues of the entire body. But we are talking about mental health here. So if the parts of the brain that you need to have balance and feel good and well and not be anxious and not be depressed are not getting enough oxygen, guess what? It doesn't matter how much therapy you do. It doesn't matter how many SSRIs you take or your antidepressant, anti-anxiety, sleep meds, all of those things. Like, this is what I'm seeing. The remedy here is to repair the anemia. Look at what the hormones are doing. Do the hormones need to be optimized? And then if all of those things are dealt with, and, therapist on board and all of that, then you look at the psychotropic drugs. Anyways, that's a big soapbox for me. I could talk about that one at length, but I won't bore you. You're here for a quick, cute little episode today, and I'm going to deliver the goods. So next episode coming up, I will be discussing the most contemporary research, what we know about mental health at peri-menopause and menopause, and I'm just going to bring it right to your door. Now, I want to say something interesting about iron deficiency, anemia, and mental health. I went into the research this morning. I went to do a PubMed search, and when I put in the parameters iron deficiency, anemia, and mental health, all that came up, all of it, was related to women and pregnancy. I had to scroll really far down in order to find a piece of research that connected it to midlife. And so what I want to say is it's really clear to me that we are aware that iron deficiency anemia is a big thing after labor and delivery, after pregnancy. How often does it get corrected then? In my clinical experience, anecdotally, not very often. Which means if a woman's having her babies in her 30s and perimenopause starts 35 to 45, she goes right from iron deficiency anemia or anemic from delivering those babies into perimenopause, and it never gets corrected. Now, this tends to level out when we're no longer losing blood every month. So once you're menopausal, within a few years, if you're anemic, that tends to go away. Okay. There are some barriers to that, which are beyond the scope of what I'm going to talk about today. I do discuss them more in episode 86, but I just find it so interesting that we've got all these research money to pregnancy, but almost none to menopause. And nobody who listens to the show is surprised by that. But this is the world we're dealing with. This is why your providers don't have the details of what you need, because we're just learning. We're just starting to look at these things. And it will be much, much better for our children and our grandchildren and our nieces. As we get older, they will benefit greatly from this time that we have pressed the experts around us and said, I know you don't have the information, but go find it and please fix me. So, with that, with a giant boatload of love, I send you off with this episode on mental health and iron. Hello, ladies. Dr. Fiona Lovely here. This is the Not Your Mother's Menopause podcast, making hormones make sense. And I think this is a really important area to discuss, especially for women in the menopause transition, because so many of our sisters experience anxiety, depression, ADD, ADHD can come up at midlife, and you're going, what the hell? This, I never had a problem beforehand. Not to mention the menopausal rage, the anger, the irritability that can come along with the egress of hormones. And so it's good to share information. And as always, this dispensing information, I hope that it will help someone greatly. So let me share with you in this short format what I have investigated and uncovered. So, what role does iron deficiency play in mental health? So, first of all, the iron deficiency is the most common nutrient deficiency on the planet. It is most likely associated with low income and low income countries and countries that have less access to healthcare, as it is very much associated with pregnancies. And the more pregnancies you've had, potentially the more opportunity for you to have had blood loss, not to mention that, half of the population on this planet for a third to half of their lives are experiencing blood loss on a monthly basis in the form of menstruation. So this is, in a way, a concern of the feminine, of females, because we have that monthly blood loss. And while men do suffer from iron deficiency and iron deficiency anemia, it is far, far less common for them than it is for us, but depends on some socioeconomic factors. So basically, iron deficiency anemia is an inability to keep up with red blood cell production. And the red blood cells carry oxygen to the tissues, most specifically the brain, or probably, I don't want to say most importantly, every bit of the body tissues are important, but you really start to notice when someone is not getting enough oxygen to the brain tissue. I mean, the brain can survive a very short amount of time without oxygen. And so that subclinical decrease in oxygen deliverance to the brain tissues over time can show up as mental health issues. And so I'm here to say it's not just a deficiency of an antidepressant medication. There's likely a very real explanation for the symptoms that you're having. So I'll teach you how to investigate that a little bit further along here. So we know iron deficiency, again, it happens in wealthy countries. When it happens in wealthy countries, it's primarily a concern of that blood loss, that monthly blood loss, as we talk about. We know that iron deficiency is underdiagnosed, and we know that the risk factors include low iron consumption, menstruation, vegetarians, children born prematurely or with low birth weight, and also frequent blood donors. Your blood, if you're donating, let's say on a monthly basis, but you're not consuming enough iron in the diet, then chances are you're going to end up with an anemia because your red blood cells just cannot be made to accommodate that blood loss. As I said, pregnancy is also a risk factor, and the more pregnancies you've had, the more likely you are to have an iron deficiency. And also those have celiac disease. And the research shows this may not be just a malabsorption problem, but more of an iron loss problem, which is interesting. We also need more research on that. So the research shows the correlation between iron deficiency anemia and depression for women in their 40s. Men are also included in that study, but again, their incidence for anemia is far less. Their explanation for depression there are other factors, let's just say. The iron deficiency anemia presence has a significantly higher incidence of anxiety disorders, depression, and sleep problems. So people who are experiencing anxiety disorders, depression, and problems with their sleep are more likely to have iron deficiency anemia. Really interesting. So, one study followed patients over 2 years in a psychiatry office. And what they found was that 80% of the people that were showing up for psychiatric care had iron deficiency anemia. 80%, actually more than 80%. Isn't that fascinating? So, there is something here that needs to be investigated. And when these patients were given an iron supplement, this was their experience. So, they were given this they were either given an antidepressant medication, anti-anxiety medication, a psychiatric medication, or they were given iron supplementation. Okay, so the iron supplementation group, the patients experience less hyper emotivity, so less experience of emotions, really high emotions, really low emotions, less anxiety, less irritability, less aggressive behavior. They were less sad and less apathetic. They also had less restless leg syndrome, eating disorders, and they showed improved cognitive performance. Now, I realize this is one small study, but there's something there that needs to be investigated. And I think it's really important to have that discussion with your doctor or your prescribing physician and say, okay, could this be something else going on? So much more to be studied, but the takeaway is there appears to be a correlation between low iron and mental health decline. So we can do something about that. First of all, we can look at the risk factors and say, are there any of these things that are voluntarily I'm participating in that I can change those lifestyle behaviors? Am I a menstruating female? Am I getting an iron supplement? Am I doing that iron supplementation correctly? Has my doctor tested me? Is my doctor monitoring this situation? So again, have your doctor test you for iron deficiency, consume healthy foods daily that have iron in them. Listen, I could list those, but the truth is, it depends on your lifestyle. It depends on what kinds of foods you like to eat. It depends on your culture. It depends on the availability of those foods. So please just Google that list, foods with high levels of iron or foods containing iron, and pick your favorites off of those and consume them daily. And supplement correctly if low. And so I say it like that because not all iron supplementation is created the same. And there are things that you can do around your iron supplementation that makes the iron more absorbed. And that's a really important factor. Episode 86 that I recorded does talk about how to do that iron supplementation properly. And so my recommendation to you is have a listen to that episode. Important to have your blood tested before considering antidepressant, anti-anxiety medication. Talk to your doctor about this. If something just feels off in your chemistry, if you've normally been a happy person, but something just happened, again, have this investigated. Don't just take the one most common treatment and say, oh, that must be for me. But dig a little deeper. Now, iron supplements are not for everybody. And having too much iron in the body, which is not typically a problem for women, is problematic as well, although a far easier fix for sure. So it's not for everybody. Make sure you have your iron tested to be sure that you are in fact deficient before you consume the supplementation. So I hope this was helpful. If you want more information about me and my work, you can go to my website, drlovely.com, and I'll make sure all my social links and things are in the show notes today. I hope you are doing well, and until next time, take care. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.